I'm Sunil Benju from EMR second year.
Hi, I'm Som Benju, EMR second year.
Hi, I'm Dushdima, second year EMR.
Hello, I'm Dojika Singh, EMR second year.
Today, my team will be demonstrating on spinal immobilization. To immobilize the spine, we need a device called a spinal board. What is spinal board? Spinal board is a patient handling device used primarily in pre-hospital care. It is designed to provide rigid support during a movement of patients with suspected spinal or limb injuries.
Okay, for any procedure, there will be adverse effect, indication and contraindication. Some of the common clinical issues found with spinal boards are pressure sore, pain and discomfort to the patient, respiratory compromise to the patient, and some contraindications of spinal board are alternate status, penetrating chest trauma like flare chest or rib fracture.
To approach any kind of the trauma patient, we have some norms that are, we always have to determine the scene, whether the scene is safe or not, and determine the nature of illness and mechanism of injury. Also determine the number of patients. If the number of patient is more, we have to ask for the additional help and additional resources. And we have to also gather the equipments according to the patient condition. The equipments are examination gloves, long spine immobilization, that is long spine board, and head immobilizer, C-collar, patient securing straps, blanket, padding, and tapes. For this demonstration, we are assuming that the scene is safe, and we all are in full PPE. The mechanism of injury is trauma, and number of patients is 1. There's no need of any additional resources, and we have gathered all the equipments for this patient.
To demonstrate this procedure, we have to immobilize the C-spine. Then we will go for our initial assessment, that is general impression. General impression of this patient is patient lying on supine position. Then we will go for a level of consciousness using mnemonic ABPU. Then we will go for a airway breathing circulation. And this procedure is done by look, listen, feel. Look for chest rise and pulse. Listen for ear passing, and then feel for a pulse. Then we will go for a rapid trauma assessment. For rapid trauma assessment, we'll go assessment from head to toe using mnemonic DKBTLS. Now my friend Doji will immobilize the C-spine. I am doing initial assessment by looking the chest rise and fall, and this patient is in good, adequate chest rise and falls. And now I am listening for ear passage. Now I will feel for pulse, and pulse is strong and regular. And then I will go for a rapid trauma assessment from head to toe using DKBTLS. And then I will check for a cervical for any tenderness. Then I will look for a jugular vein distension and tracheal deviation. Then my friend Sunam Bunso will immobilize using a cervical collar.
Use the cervical collar. First, we have to measure the patient neck and edges with the collar. Then we have to apply the collar without moving the head.
After immobilizing the cervical, we will examine the chest, thorax cavity. To examine the thorax cavity, we will expose the patient's chest and use the DKBTLS. abdominal, we look for firmness, tenderness, and distension. For pelvis, we will slightly apply pressure inward, outward. For lower extremities, we will use decayed BTLS, and any sign of fractures, bleedings. And we will check for PNS, pulse. Can you feel where I'm touching? Lift this leg. Can you lift this leg? Then I will go for upper extremities using decayed PTLS. And any sign of fracture, deformities, and bleedings. Then I will look PMS. Can you feel where I'm touching? Can you move this hand? Can you lift this hand? Can you lift this hand? Well, I'm examining the PMS, and the patient's PMS is good. To immobilize the patient, we have to apply a spinal board. To apply a spinal board, we have to do a lock roll.
One, two, three.
Then we have to do a posterior examination by using a decayed PTLS.
One, two, three.
On the spinal board, we have to do paddings. Then we will secure patient from chest to lower extremities. First, we will take torso. Second, we will secure at pelvis. Third, we will secure at lower extremities. Lastly, we will go to secure at head side. After patient is securing on the spinal board, we have to recheck the PMS. His pulse is strong and regular. His capillary fill is less than 2 seconds. Can you move these fingers? And we have to check for other side of the hand also. His pulse is strong and regular. His capillary refill is less than 2 seconds. Can you move this finger? Then I will go for lower extremities. His pulse is strong and regular. Can you move this toe? Can you move this toe?
After stabilizing patient on the spinal cord, we have to perform appropriate secondary assessment and obtain vital sign and sample history. We also have to manage secondary injury and we have to communicate for the medical direction. And we should not forget to document all the information which has been obtained while doing patient assessment.
After reassessing the PNS, patient's PNS is not compromised, so we can shift patient to ambulance for transportation.